We are talking about ulcerative colitis. Ulcerative colitis is sometimes identified as a hidden disease or disorder. It is largely considered autoimmune. Autoimmune means that our immune system, normally the thing that repels invaders, and we've identified it as a war machine. That is what it does. Its specialty is killing other life forms. And so autoimmune means that something has gone haywire and your immune system is now seeing part of you as an invader. And it can affect a small portion, like an individual little area like this, a whole section like that, or the entire large intestine. And why it's kind of called a hidden disease is because people can be suffering with this, be miserable. It can cause social disruption because we've talked about what does your large intestine do? It regulates, some nutrient absorption. There's bacteria here that are creating vitamins. But the main function is that fluid balance. And when it is thrown off, you can end up with constipation and bloating, or in this case, more likely, very bad and uncontrollable bowel movements. So diarrhea, where your colon is not absorbing water correctly, or nutrients, or the food that's left over. It's not handling it all the way it should. And so you can get some very embarrassing and socially awkward moments. And that's on top of the fact that it causes all kinds of abdominal cramping and pain. So let's just take a look at the tunnel here. So we're just going to poke through this wall. And in here, this is what normal healthy tissue would look like. And I'll throw up here some images of ulcerative colitis where this tissue has been just ravaged by the immune system. As far as treatments go, there are three main attacks for this. There's dietary, so some form of specialized diet. That's going to involve seeing a dietitian or, going through like a food map and figuring out foods that actually do tick it off. The next one is going to be managing stress, making sure that you have that mind-body alignment, which is very hard to get these days. But both of those actually play into the third, which is managing the immune system. And that is largely done, if the first two don't work, through prescription medications. And I want to make sure to mention Carafate, because if you've never heard of that, it is worthwhile to talk to your doctor about. It actually coats the intestine. And then there are some new generation immunosuppressants, which that just comes in as a prescription medication that suppresses the immune system and stops it from attacking the tissue. Okay, so if you have questions, let me know. That's it for right now.